You can get a lot of macrosomia babies are born. Now the macrosomia babies, you have to be careful because they are more prone to fetal hypoxia, sudden intrauterine death, and during birth, shoulder dystocia and brachial plexus injury. Shoulder dystocia is when the body measurements of the fetus, especially the shoulders and the abdomen, exceed the head measurement. The risk of shoulder dystocia increases not only in large for gestational age babies, but also in normal weight babies. And a shoulder dystocia can also occur during a cesarean section. So ultrasound can give you measurements and warn you about shoulder dystocia, which can occur. So what are the general guiding principles during labor? There is a delayed lung maturity in fetuses in pregnancy with GDM. Hence, routine delivery before 39 weeks is not recommended. In a pregnant woman with GDM between 24 to 34 weeks of pregnancy and requiring early delivery, antenatal steroids should be given as per the guidelines, because we should not hesitate to give steroids, because steroids would increase the sugar levels and make it abnormal, and for that you have to compensate by giving her either more insulin or telling her to be aware of her sugar levels becoming abnormal. And either you can use injection dexamethasone 6 milligrams 12 hourly for 2 consecutive days, or you can use injection betamethasone 12 milligrams 2 doses 24 hours apart. Blood glucose should be monitored closely for 72 hours following dexamethasone or betamethasone injections. If blood glucose levels are raised during this period, insulin dose should be adjusted accordingly. And vaginal delivery should be preferred in most cases, and LSC is done for obstetric indications only. What about timing of delivery? Good glucose control with diet and exercise. If the patient has been controlled well with only diet and exercise, there are no complications, no macrosomia, no hydramnios. You can have an expectant management even till 40 weeks of gestation. If your patient is on insulin, induction of labor is generally advised at 38 weeks, because we want to decrease the incidence of shoulder dystocia and we don't want a sudden stillbirth to happen. In a GDM which has got a hypertensive disorder or a previous stillbirth, induction of labor at 37 weeks is probably more preferred. So any time between 37 to 38 weeks is a good period to interfere and deliver these patients to give them a healthy newborn.